Healthcare careers shouldn't be a mystery. They shouldn't be reserved for people who already have connections or know the right people. I'm Abby, and this is Healthcare Unveiled, where we have honest conversations with healthcare professionals about their real journeys, the good and the challenging parts, so you can figure out if and how this path might work for you. Good afternoon.
Hey, how's it going?
It's going good. How are you?
I'm good. I'm good. I'm excited to be here. I'm going to be honest with you. I'm a little nervous because I don't normally talk about myself this way. So I have a bunch of notes, but if you get like a jittery vibe from me.
I am jittery as well. So we're in this together right now. So if you see me looking down or anything, I also have notes. I have a list of questions to ask.
Cool.
So you can ignore that.
Yeah.
Okay, ready?
Yep. Yeah.
So thank you so much for coming on today. We really appreciate it. And first and foremost, do you mind introducing yourself?
Yeah, totally. My name is Taryn Bilo, and I work for the National Healthcare for the Homeless Council as a medical respite manager. I have a master's in public health, and I'm based in Portland, Oregon. And I have a grumpy dog that's right next to me. So if you hear a whining in the background, that's
No
not me.
worries. Do you mind telling us also what is your educational and professional background? Because I know you did mention having a master's in public health.
Yeah, totally. So I have, yeah, so last spring, March of 2024, I just graduated with my master's in public health. It was a couple of years after undergrad, which I got my bachelor's in 2012. So I was in the field for a while, but primarily I worked in direct service homeless services before coming to the National Healthcare for the Homeless Council. So direct kind of running of shelters, case management services, and then supervision and program development, and then starting a medical respite program, which is how I got to the council.
Got it. So I think you know this, but your career is definitely really unique. And so I was wondering if there was a specific moment or experience that you had that sparked this passion for working with the homeless.
Yeah, totally. So when I was in undergrad, went to school in Olympia, Washington, and I signed up for a couple different volunteer roles while I was in undergrad. I was kind of just trying to see what fit in, what felt right. I knew I wanted to do something that was kind of in the nonprofit world, but I didn't really know where made the most sense for me. And at one point, some sort of like, I guess maybe volunteer recruiter or something like that came into one of my classes. And through that, I started volunteering at a housing resource agency, and then made a lot of connections in the community. Olympia is a pretty small town, so a lot of people know each other, and there's a lot of like kind of cross-pollination of different services and getting to know people. But through that, I met folks that were starting a low barrier homeless shelter, which was the first in the community, and I ended up being one of the first staff that was hired at a 2021 pretty young age, and was able to be a part of the program development from a really small program to now I think it's maybe like a $3-ish million program in the past, like, gosh, I guess it's been 11 years now that it's been open. So then, yeah, just like so much working in direct services, really like getting to know clients, understanding what's going on, and then wanting to think about it a little more in the upstream kind of way, or the field as a whole.
So you
Yeah.
would say that your volunteer work played a big part in choosing your path?
Yeah, absolutely.
And you said you just knew you wanted to work in the nonprofit world, but had you felt anything else out before? Was there any other paths you were kind of considering?
Yeah, yeah. I mean, I've definitely have always thought about maybe going instead of, I did end up going to get my master's in public health, but I was really thinking about a master's in social work at a different point of kind of trying to continue to do that direct service. But I have thought at different times about environmental kind of justice, but the math was a little bit of a barrier. And then also some different things about like criminal justice reform. Yeah, but it was definitely through my volunteering and making connections that I was able to get where I am today.
Definitely. So from the beginning, did you know that you wanted to go to graduate school?
No, no. And I went back and forth about it a couple of times because, I did work without it for a number of years, but I kept hitting this wall of like what felt like my competency. So I know you're working with like a lot of different people in the health world. So basically, in homeless services, there gets to be a certain point in direct service where someone either, like, a lot of people are like, okay, well, what it here is next. And a lot of them do take the path towards like nursing or some sort of like NP program. And I was kind of thinking more, or they go into like really hard research kind of world. I didn't really want to continue to commit to like a life of direct service because it is just so, just emotionally, it's just a lot and it's physically very demanding. So I was trying to think about where else I could plug in. Yeah, and I don't know if homeless services is going to be where I'll be forever, but it's where it feels really good to me right now.
Okay, so more specific on working with people who are experiencing homelessness. So, for people who might not be familiar, can you explain what medical respite care is and why it's so critical for people who do experience homelessness?
Yeah, totally. It is a newer model too. So medical respite care is, it kind of comes out of this like blending of medical services and housing services for people experiencing homelessness with acute medical conditions that brought them to a hospitalization. So it's for people leaving the hospital, but they're not necessarily like if they were housed, they would be discharged to their home, but because they don't have a home to be discharged to, the hospital can't necessarily discharge them back to the streets because that's considered, malpractice or it's like, their condition is going to continue to get worse or they don't have somewhere to recover. So this is a short term. It can be between like 2 weeks and like 90-ish days stay where people get to focus on their acute condition. Often it can be wound care or some sort of like chronic health condition that's in acuity, like heart disease or something like that, that they can get to a more stable point in before, and then also with the goal of having case managers on site to try to think about, okay, well, what is next? Like, how can we disrupt this cycle and hopefully get them out of this unsheltered homelessness cycle? Something that's happening a lot is that our hospitals are extremely overwhelmed. Hospital systems are kind of failing, is not like the word I necessarily want to use, but they're at max capacity all the time. It really makes sense that hospitals are kind of like, well, we need to be discharging people, we cannot. And then that's where social service agencies or FQHCs, which are like low income health centers, can come in and be like, okay, well, we can provide this care that we were already going to because if the person is discharged right to the street, we'll be providing the care anyway, but it's more formalized. They're often paired in a shelter. So, like one dorm of a shelter. Yeah,
What do the
that's the medical
stays look
respite model.
like in the shelter? Like, have you seen firsthand what the stays look like and the different roles that are involved in the stays?
Yeah, so there's different models. I did start a medical respite program in Olympia, so we were co-located towards the end of it after our pilot stage. But what it normally can look like, it can look like a lot of different things because communities are so different in their resources. But the baseline version is that there's a certain amount of beds, there's a dedicated case manager for these beds, and then they have access to medical care and then just general hygiene services and other kind of housing services. There are higher level of care medical respite programs that look more like a kind of step down hospital that are run by nurses or really have a stronger medical aspect to it. Those are often a lot shorter term of a stay because it is kind of this like step down to the step down, but those are normally attached to another shelter where people can be transitioned to after that.
Do you think there's any qualities that are important for somebody who might be working directly with people who are experiencing homelessness during those medical stays?
Yeah, totally. I mean, I think that, patience and kind of coming from it with like a really open mind, there's a lot of issues that are not unique to people experiencing homelessness, but are more obvious, like behavioral health stuff, substance use challenges. So some sort of like adaptability is really important. Yeah, and then just kind of being really interested in learning and learning what best practices are because a lot of these programs, they'll be kind of very much grassroots or DIY, and not necessarily and kind of like often reinventing the wheel that already exists from like someone like me who is, looking at the field overall and is like ready to share best practices.
Okay, so thank you very much. I know you mentioned behavioral health. So I know that your work and your focus is a lot on integrating behavioral health and substance use services into medical respite programs. And so
Mhm.
I was just wondering, like, what Might this integration look like in practice, and why is it so important?
Totally. Well, I think that a huge barrier to people being able to take care of an acute, whatever their acute condition is, or reaching their health goals can be these behavioral health or substance use challenges, which often, if there are enough tools that the person has or some sort of like autonomy and empowerment, they can reach and surpass that. But it is obviously significantly harder without. What we are exploring right now at the National Institute is kind of starting from the top of each medical respite stay, integrating a behavioral health intake form into just like the general intake to try to catch everyone and then make sure that there are pathways to referral for appropriate substance use services. One thing that is challenging, especially with that medical word in the medical respite, is that it kind of takes this one aspect of health, right, of medical, and what we're trying to do in the field is to move it more towards this holistic part where it includes, social, behavioral, all of the different things of like, what does health really mean? Because it's often pretty impossible to just take one and then be like, okay, well, I fixed that. And then, here you go.
What do you think are some barriers to moving health in that kind of holistic direction?
What I do know is that most places are seriously underserved as far as like what resources are needed. So that's a huge barrier. And then also just kind of the general attitude of our current society. There's a lot of like stigma and shame associated with substance use, mental health. I think that has changed a lot, but it still is present. So yeah, that's kind of like a cultural shift that I think is a huge barrier as well.
Got it. Thank you so much. So, similarly, I know that you've mentioned before that using social detriments of health as tools for improving different outcomes. And I was just wondering if you could give us like a concrete example of how addressing these factors has made a difference for somebody you've worked with.
Yeah, totally. So, like social determinants of health, they mean so many different things, like housing status is one of them. So, if you're able to just even taking this like medical respite model, if someone who is in unsheltered homelessness has access to some sort of stable living, that can really be a huge game changer about whether or not they can get their wound to heal, whether or not they can be connected to services. And then, even this short-term stay can give them time to kind of plan what their next steps are. But of course, that's not the only one. I mean, I think that, there's all kinds of marginalized identities that people go through this world with every day that are huge barriers to different things that they may need. Gender identity can be a barrier to even getting into a shelter if you're transgender, or a plethora of other things. The behavioral health, the history of SUD is often a limiting factor for what their programs a person may be eligible for. So it's kind of never ending, but language, just so many.
So, during these temporary stays, I know you mentioned that period of time gives somebody the kind of room to plan what their next steps might be. What do these next steps look like?
It varies a lot from case to case, and place to place. So it really goes back to like what services there are. Often, I was just in California visiting a program that they had a shelter on site and they were able to discharge most of their medical respite people back into this like general population shelter. There's a lot of places where that's not an option. There are no other shelter beds and people can be discharged directly back to unsheltered homelessness. Of course, that's never the goal, but it is part of the nature of the short-term stay. A lot of places have like coordinated entry, which is like one point of like you do like an intake and then you're put on like a housing list and it includes like all of the shelters. So then people in the medical respite program can put them on coordinated entry lists, but that'll be like kind of, it's like a triage based on vulnerability often. Yeah, it really depends.
Interesting. Okay. And I know we were just talking about different like marginalized identities. So I know that some of your work also includes developing best practices for gender-affirming medical respite care. And so I was wondering, what are some of the unique challenges that LGBTQ plus individuals experiencing homelessness might face in healthcare settings?
Yeah, totally. I think, there's a couple, but one of the ones that comes to mind the most is just kind of the way that shelters are often set up in these gendered male, female dorms or whatever, and then how that can kind of create these points of friction with other clients or staff who are unfamiliar. So I think that really focusing on staff training and then also like client autonomy and having a really strong like no violence policy is really important in programs, and including like quote unquote hate speech to be part of the no violence policy. Yeah, I'd say those are the two biggest things.
In what ways do you think the staff training could be improved?
Yeah, I think, well, it really depends on programs, but I think that, getting feedback from clients with that identity can be who have gone through your program could really improve both, policies and procedures, but also the training. Yeah, I think that if there's any kind of like, oh my gosh, I'm trying to, but like training that has to do with the specific identity, really valuing the voice of whoever is someone that identifies with that marginalized identity is important. So having representation on staff can be really impactful for who shows up to your program.
I imagine there must be a very large culture shock between some of the staff who work with the homeless and then the people who are coming into the shelters. Have you seen any like clashes between staff and people?
Oh yeah, totally. I mean, I went to like a liberal arts college and then I started working like in homeless services. So it's like, yeah, absolutely. It's like different education, different language. People get different news sources. Like, there can be so much to bridge as far as stuff like that goes. But at the end of the day, what I really find often, even if it's like interacting with like a challenging like business owner or something like that, we're all human and we all really can like if you like widen the scope or even tighten it, you can be like, okay, well, I'm sensing that like this person is like feeling fear about XYZ thing. I can like empathize with that. How do I like move through this interaction in a way that's like affirming for their experience, but not necessarily whatever like belief they may be saying? And how do we also like keep it safe for like the people who, may be impacted negatively by whatever is happening. But I think that really like there's so much more to gosh, like collaborate or like enjoy each other's company about versus like all of these points of tension. But I think that it really does have to do with, leading with empathy, curiosity, and kind of like those being strong and like developing your social skills.
The shelters that you've worked on or like worked with, have there been any policies in place relating to, I know you mentioned before, hate speech, and how does that play out?
Yeah, totally. It can be a little bit tricky, especially like going back to like we all have like different like thoughts about the world,
Of
places we get our
course.
news or whatever like that. But I think that really just like the more broad that you can have it. So like at my old job, it was like we had a policy where it's like we don't say things about other people's bodies, So like no matter what that may be, a lot of things can fall under that, and including these like different versions of hate speech. And then we just had like a really clearly listed like what we defined as like hate speech, and like slurs or saying XYZ about a person is considered that, and then having it be a part of like a communal space use agreement that applies not only to clients specifically but also staff, any volunteers that are coming, so it's not necessarily this like punitive thing that's focused on the clients, but it's like this is the space and this is what everyone is agreeing to when they enter this space.
Got it.
So
Thank
more
you.
you can like broaden it. Yeah.
Okay, so more on, I guess, policy and that kind of work. So I know that you also, and you can correct me if I'm wrong, I'm pretty sure you also help programs navigate state and federal policy. And so I was wondering, what are some of the biggest, I guess, policy barriers that you see that prevent really effective care for the homeless population?
Wow, what a big question. I mean, I think that we're in some pretty uncertain times right now where things change pretty fast. So whatever I may even say today specifically may be different tomorrow. But I think that, the way that Medicaid is being targeted and kind of cut and the amount of people that we think are going to be losing it is going to really impact our experience or our people experiencing homelessness population specifically. There's some work requirements and other things that are happening that require like such a high level of tracking and reporting and certification to stay on your benefits that for me as like a high functioning person with a master's degree who is housed, like I don't know how well I'd be able to navigate it myself even. So thinking about people who have all of these barriers or like don't have access, there's like one that's about having an address specifically, where you will need to have an address for like to be on Medicaid. And we're concerned that programs are going to be flagged for fraud because they're using their address for so many different people. So, yeah, I would say definitely I feel concerned about the Medicaid stuff. But there is some cool things happening in individual states. So, like, I just got off a call in Washington State where medical respite is being piloted as a reimbursable service. And this is their first health related social needs service that's being piloted in this way. So there's an opportunity for health plans to be at the table instead of just the hospitals and try to find like a more sustainable funding source that could really promote longevity of these programs. So lots of things are happening every day, I feel like.
Definitely. Things are always changing.
Yeah.
Okay, so similarly, um, I guess this is more so focused on like challenges and solutions. So I know working with such a vulnerable population with a lot of different barriers is really difficult, especially while navigating like such complex systems. How do you prevent burnout personally, and what keeps you motivated during all of this? Because again, things are changing a lot and it is very difficult.
Yeah, totally. Oh my gosh, what a good question. Well, the one thing that I really wrote down that I wanted to talk about is that I think that for anyone that's kind of thinking about how anything in health or really anything at all, as far as like pursuing a career goes, is to really spend time with yourself, get to know yourself and what your values are and what's important to you. So you can have that to fall back on, especially like as things may arise in an organization or whatever may be coming in the world that we live in. So I think that spending the time to really understand what my values are, what's important to me, and then being able to fall back on that during hard times is super important. And then also, one thing that has been awesome in the past couple of years is that I've been trying to really separate my personal identity from my work identity. So, like, I am not the place that I work at. I am not but I did feel like I was like the place that I last worked at. And so if something hard was happening there, it was like something that I felt inside of my own body. So, like not responding to emails at night or like thinking about how to make things more sustainable for you, not being in a like, you'll never get to the bottom of your list. So, like, it's important to be proactive and pragmatic, but like, don't dude, don't try to do so much that you like use your like reserve energy, you know?
Yeah, I got you. So,
Yeah.
kind of similarly, how do you maintain that kind of separation? Because especially if somebody's passionate about what they're doing, I know it can feel like that's their whole identity. How do you maintain that kind of balance and that space between who you are and your identity and then the work that you do every day?
Yeah, totally. I mean, that's super hard. I'm still learning that like every single day. But I think that it's been really important to me to kind of like get back into like kind of like other like creative ventures or, like I just signed up for like a metal smithing class because I'm like wanting to continue to do like education stuff. But it can be super hard. It can be so
Definitely.
hard. I don't have like a more concrete answer, I don't think, but just like keep trying to do it, you know?
Yeah, we're all figuring it out.
Yeah.
Okay, so kind of similarly, for somebody who might be listening in and wants to work in homeless healthcare or public health, what general advice would you give them? And are there any non-traditional pathways that you think should be considered?
Yeah, yeah. I would say right now to make sure that you kind of, especially at first, that's awesome. That's not a super common thing that people are looking for as far as a career goes. But I think just to be, aware of what's kind of going on this national level, there's like a lot of like funding cuts that are happening with different programs and that are anticipated for the future. So just make sure that you feel like you have a skill set that is like applicable to a lot of different places, but do it. Like totally do it. Also, there's so much that needs to happen in this world, and we really need people at the table who are energized and excited and want to get to know, this population, especially if you have lived experience or you have a personal relationship to homelessness. That is like a voice that's super needed. And also, yeah, just always try to like center the people in all of the work.
Definitely. Thank you so much. So, kind of similarly, what kind of misconceptions do you think people have about homelessness and working with them in healthcare? And how do you address those in not only like the work that you do, but in any training that you've seen? Because I know there is a lot of stigma around
Yeah.
homelessness.
Yeah, totally. I mean, I think that our society like perpetuates a lot of that, and it makes total sense that it shows up in the healthcare field as well. I think that also a lot of people in the healthcare field have really, really high expectations of like the amount of people they're expected to see or like their workflow. It's like this is like these are very stress like high stress jobs, so it makes sense that it's hard to like slow down a little bit, especially when these like social determinants of health stuff are coming up, or these like soft services that aren't necessarily like health related explicitly but can take up a lot of like time and energy, or like a behavioral health thing happening in a health visit or something like that. But I think that trying as hard as you can to have like a trauma informed approach, defining what that means for you, and then also remembering that every person is the expert in their own experience. So when you're meeting with a client, it's so easy to be like, well, I know what this person needs. Like they need to like do XYZ thing. And that's a super easy thing to do on the other side of a table or as the person in power in any kind of appointment. But really just remembering that we are just or this anyone who is not the person that you're meeting with is not the expert. They should not be in the driver's seat. And we're only in control of like a really finite amount of things, every person. And we're definitely not in control of like behavior of someone else or like any life choice that they make. That can be really hard in all of this. Yeah, I would say just trying to be trauma informed and then also just being gentle with yourself when you're in a massive rush.
For sure. Thank you. And so I have two more questions for you. Sorry for keeping you so long.
Okay.
So, if you could change one thing about how our healthcare system serves people who do experience homelessness, what would it be?
Yeah, I think that I would try to get people to kind of think about everything in this like more upstream way where it's like, well, why is this happening to this person, right? A lot of these things are like wound care related issues or something like that. And it's like if someone doesn't have a house to like take care of their wound in, like that's why they're like ending up in this like emergency room. Like this person is in crisis, like why? So I think maybe kind of like bridging the gap between like social services and healthcare services.
Definitely. So, my final question. So, obviously, we know with cuts to Medicaid and just funding in general being a struggle, public health as a field, and I know specifically working with people who experience homelessness is definitely difficult and it's really easy to lose hope. So, what gives you personally the most hope about the future of whether it be working with people who experience homelessness or public health in general?
Yeah, I mean, I think it is like so easy to lose hope, but I think that just really like seeing all of these really powerful things that happen in response to these challenges, like DIY or grassroots community movements, and watching how people are turning towards relying on their community when they're unsure of what it what the future may look like as like a society.
Do you say like relying on your community in that way?
Yeah, like I would, mutual aid kind of stuff, other kinds of different. I'm trying to think of how to say this in a way that feels chill. Like, this, like the three West Coast states, like Washington, Oregon, and California, created this like alliance for preserving some different like public health stuff that's being like challenged on a federal level about like vaccines. Yeah, I think that watching like responses to different like challenges that arise and then just realizing like, yeah, how powerful community is and how so many of us are really engaged, even though it can feel like it's such an isolating time.
Thank you so much. So
Yeah.
that about wraps things up, and I want to thank you again for taking the time to speak with me. I really appreciate it.
Yeah, it's so nice to meet you. Are you thinking about going into public health or just?
Yeah, I'm
Oh,
thinking about going into public health, or I'm trying to do something relating to public health policy specifically.
that's awesome.
But we'll see how things go because it's
Yeah,
rough out here.
yeah, that makes sense. Well, whenever, I don't know, whatever your next steps are, feel free to reach out if you ever want to talk more. We have a policy team here. So if you're ever interested in learning more.
Thank you so much. I definitely will
Yeah,
reach out. Again,
cool.
thank
Yeah.
you for meeting with me, and I hope you enjoy the rest of your day. We really appreciate hearing from you.
Yeah, totally. Have a good one.
You too. Thank you so much. Bye bye. Thanks for joining us for this episode. Don't forget to follow us on Instagram and your favorite podcast platform. You can find us at Healthcare Unveiled. And remember, healthcare shouldn't be a mystery. And with the right information and support, it doesn't have to be. Until next time, I'm Abby, and this has been Healthcare Unveiled.